Welcome back to World This Morning with Shaza Hashmi, ladies and gentlemen, on a beautiful, pleasant day. Again, Ramzan Mubarak, I'll keep saying it to all of you out there. And before we went out on a very short break, I mentioned that today we are observing a very important day all across the world, not only in Pakistan. And ladies and gentlemen, today happens to be World Thalassemia Day. Now, for all of you who don't know, thalassemia happens to be a disorder or a disease of blood. It is a genetic disorder that occurs, let's say, in males and females both, equally or not. That is what we're going to ask, along with so many other things with our very apt panel over here. But before we move on, I'll tell you the theme for today, ladies and gentlemen. It happens to be universal access to quality thalassemia healthcare services, building bridges with and for the patients. I feel like these are the things that we need to talk about, so important. And for this very purpose, we've been joined by some amazing guests, as I've already mentioned. This one has been on the show before as well. She is none other than Dr. Tahira Zafar, who happens to be a thalassemia expert. Hello, assalamu alaikum, and a hematologist too. How are you?
Very well, thank you. Wa alaikum assalam. Nice to see you, Shaza, again.
I know, same here. Always nice to see you. Next to Dr. Tahira, we have someone who happens to be a retired Major General. He's none other than Dr. Suhaib, Ahmed, who happens to be the President, Thalassemia Welfare Society. Assalamu alaikum. Welcome to the show.
Wa alaikum assalam.
And next to Dr. Saab, ladies and gentlemen, she is a very special guest. I mean, she is very courageous and brave, especially to be here and share her journey, her life with us, especially on this auspicious day. She's none other than Saira, Yahya. Assalamu alaikum. Welcome to the show.
Thank you so much.
She is a person living with thalassemia every day. You're so brave. Thank you for coming.
Thank you so much.
We will definitely, come to you. But to start with, Dr. Saab, I feel like we should start with you. What are the current prevalent conditions of thalassemia in our country? And, well, let's start with that first.
Well, if you want to remember thalassemia, it's easier to remember that if you remember the figure of 5.
Okay.
5% of people in this country, they have thalassemia minor.
Okay.
Or you can say they are thalassemia carriers.
Right.
And then every year, there are about 5,000 new children with thalassemia major. They're born with it. And at one time, we probably have something like 50,000 patients of thalassemia major in this country.
Okay.
So this is about the prevalent situation.
And you're absolutely right. This was, in fact, last year, ladies and gentlemen, according to the latest statistics of 2018, around 50,000 people have been diagnosed with thalassemia, are living with actually thalassemia, diagnosed ones. We don't even know about the ones who have not yet been diagnosed, right?
I just wanted to add in here that with the population statistics, 5 to 6% having the thalassemia gene or being thalassemia carrier, with our total population now, the overall burden is about like 10 million of our people have this gene in them in Pakistan.
Oh, okay. So there are chances, of course, of developing it. Ma'am, you said it's a genetic disease.
Yes.
So are there like any chances of females developing it more than males? Is it gender-based?
No, I think you're remembering hemophilia, which
Yeah,
we
that's,
talked
I'm
about
relating
last
it,
year.
yes.
Yes, that is a disease which is carried by females, but which is present in the males.
Yes.
Thalassemia is nothing like that.
Okay.
It is equally present in males or females. So
Okay.
it is an inherited blood disorder. That means that parents pass it to their offsprings.
Okay.
And you need to have 2 genes for it to develop the disease.
Okay.
The patients, when we are saying carriers or thalassemia minor, just means they have 1 gene.
Okay, okay. And when you have both of them, that is like a severe case of thalassemia.
Yes, that is a severe case. With 1 gene, the people are actually completely normal. And it's only in some cases when carriers are married to a carriers, they have a child with thalassemia, and only then they find out that we were carriers, and then when they test, it's actually proved that way.
Oh, okay.
Otherwise, sometimes in some cases, in females especially, when they have a blood test done, simple blood test, they can appear like having iron deficiency anemia.
Okay.
And then they keep on getting treated for iron deficiency anemia and don't improve. And then somebody then thinks, oh, this might be something else. And then their carrier status is detected.
Because I'll tell you, ma'am, actually hope is such a beautiful thing, right? I mean, I feel like every individual right there is living by hope. I mean, if there's anything wrong with you, any sort of probably a disease or even a disorder, because a lot of less fortunate people live out there, right? In probably less deteriorating conditions as well. Hope is something that we look forward to. Maybe tomorrow is going to be even better, and that is for all the people living with this condition as well. Before we move on to diagnosis and prevention of this with Dr. Saab, I want to move on to Saira over here. Saira, you can answer this however you want. Do you feel, first of all, again, thanks for coming. Do you feel like your condition probably stops you or limits you from doing things? As it would, like, अगर वो मुझे मेरी जिंदगी शायद आपसे फ़र्क हो और आपकी इस कंडीशन के साथ रहने से शायद जिंदगी फ़र्क है?
नहीं, मुझे नहीं लगता।
नहीं, कोई मतलब किसी डेली काम में कोई लिमिटेशन नहीं आती?
थोड़ा स्टडी में हुआ था थोड़ा, क्योंकि फिर मेरे लिए वो कॉलेज जाना थोड़ा प्रॉब्लम था, क्योंकि ब्लड ख़त्म हो जाता है बॉडी में, जब थोड़ा हीमोग्लोबिन कम हो तो थोड़ा प्रॉब्लम होता है। लेकिन मेरे पेरेंट्स ने कम होने ही नहीं दिया, वो मेंटेन रखते थे।
Oh, okay, that's great. So Saira over here says that there is no like a large difference as compared to, you know, the people living with this sort of disease or disorder, let's say. But she says she has the support of her parents and her family. There are times when probably her hemoglobin level falls low than it usually should be, which is why she couldn't go to her classes. But she's doing absolutely great. This is brilliant. But coming to you, Dr. Saab, how can we diagnose this? How can we prevent this? And do we, by the way, have the facilities of prevention and diagnosis in Pakistan?
Yeah.
Okay.
Well, a diagnosis of thalassemia major, you start with the patient itself. Generally, the child born is normal at birth.
Okay.
Appears to be perfectly normal.
Right.
And parents usually notice that after 3 to 6 months, the child starts becoming pale, and the child is more irritable, and they might have diarrheas, and the tummy might be a little protuberant. So when they feel symptoms like this, they generally visit a physician, and who then orders some tests. And in the lab tests, you can actually tell that hemoglobin is low, the patient is anemic, and this is a very specific type of anemia, which is hyperchromic and microcytic anemia. And then you proceed on to the more specific investigations like hemoglobin electrophoresis, which of course is available in the labs, but not everywhere. It's available only at specific places in the country, and we need to have more labs which can actually extend facilities.
And for that, we will come to you, Dr. Tahira, because you need to speak on behalf of the public sector. But before that, Dr. Saab, what do we have over here? Please explain this to us.
Well, this is something which is my sort of my hobby. It's my hobby. Well, I'm less of a doctor and more of an engineer. I, in fact, wanted to be an engineer, but my mother said that you have to be a doctor.
But that is like totally 180 degrees.
Well, these are small little gadgets which I have developed over years. And it's a very simple device. And this very tiny looking rack, it contains 3 tubes, and then there is one tube reagent, which we put into each of these tubes. And when we take the sample from the patient and we add that sample into each of the tubes, in about 5 minutes we can get a result from this. And this is an initial screening test for thalassemia carriers. And this can tell you that the person who's being tested, whether he has thalassemia or he doesn't have it.
In 5 minutes, you said?
Wow. It is not a confirmatory test, it's a screening test. It can tell you with almost 97% certainty that the person doesn't have thalassemia trait. So this is almost a revolutionary test. It has been in practice, but we have redefined it and modified it and improved it. And now it is started to give reproducible results. And the ones which are positive over here, then we take on to further investigation for those individuals. And
but
for
this is
there is another instrument. This is a hemoglobin electrophoresis equipment. In which we actually take the blood sample, we process it, and with the help of an applicator, we apply the samples over here, and ultimately that is transferred to this tiny little
dish
or electrophoresis tank, and then this is a very tiny power supply which looks like a mobile charger, but it's not a mobile charger. It has been modified to that extent that it can actually perform the electrophoresis. It produces about 300 volts of electricity, and in about 30 minutes you can get a result, and it would tell you whether, if you're looking for, let's say, diagnosis of thalassemia major, this would tell you whether this is thalassemia major or not. And if you're trying to diagnose thalassemia minor, then this can tell you that is it thalassemia minor or not. The beauty is that this has been produced locally. We used to import the equipment like this.
Wow.
And now we are in a position to distribute this sample,
Why not?
actually
I mean, this
instrument
is-
to various centers in this country.
This is so
You would be
revolutionary.
amazed to know that Suhaib actually in his lab he has got a little workshop
Okay.
where he's hiding most of the time and developing things like this.
Wow, this is absolutely beautiful.
And the results that we get from here ultimately are transferred to computer software, which can actually tell you precisely whether it is a thalassemia
because
minor or not.
otherwise these instruments are so expensive.
That is what I
and
was
the
gonna-
test
yes.
costs so much. But with these devices which Suhaib has actually developed, everything, how much would that cost?
The cost of the instrument is a little, maybe about 20 to 30,000 rupees. But,
Yeah, but tests,
this
yeah.
test, the screening test, this would cost you less than maybe about 10 rupees.
Wow.
Which is
Look
almost
at that.
nothing.
Just
This is
to
almost
get
nothing.
screened,
And
yes.
this combination of these two things, they can create a revolution, I can tell you.
This is
If
so
we
revolutionary already.
distribute it down to the smallest of the laboratories, you can actually bring about a revolution. Now, the actual
Definitely.
challenging part is that we have developed the equipment. We need to take it to the
To the smaller,
root-
you know,
root
to the
level.
less
Should be
fortunate
used,
ones.
yes.
Absolutely. Now, I'll move on to Saira over here. Saira, कभी ऐसा था कि आपको ऑफ कोर्स रेगुलर ट्रीटमेंट चाहिए लेकिन बर्डन पैसों का इतना ज़्यादा हो जाता है कि फैमिली के लिए भी मसला हो गया हो क्योंकि टेस्ट्स इतने महंगे हैं फर्स्ट ऑफ ऑल फिर जितनी भी आपको मेडिसिन चाहिए वो इतनी महंगी हैं तो कभी आपको ऐसी स्ट्रगल्स थी
था थोड़ा बहुत तो था शुरू में
जी।
लेकिन फिर थैलेसीमिया सेंटर में तो सब कुछ फ्री है
Okay,
तो ब्लड वगैरह मिल जाता है
Okay, perfect. So Saira over here says that, of course, I mean, like every other person out there, there are sometimes definitely, you know, money restraints. But then again, Thalassemia Center is there to help all of you, for which we are moving on to Dr. Tahira
I
over
would just
here.
want to mention about Saira. She's not only brave that she has come here, she has actually done her master's in Islamic studies.
Mashallah,
and she's
beautiful.
now doing her BA education and
Okay.
wants to continue as a teacher,
As a
really.
teacher?
So she
Wow.
has done tremendously good, and that's mainly because she became aware of the presence of a thalassemia center.
Right, timely.
Timely, and she got her regular transfusions, which are part of the treatment, and that's why she's actually developed so well.
Perfect. And good luck,
doing
Saira. And you know,
brilliantly.
when inshallah you are a teacher, you should come back to my show. But Dr. Tahira, I want you to talk about this. You know, when I was telling that around 50,000 of people last year had, you know, a thalassemia, they said that the treatment or any sort of assistance that they got were from either NGOs or any sort of, you know, private sectors or private help. What are the facilities that we have on a public
I
level?
mean, I'm not a public sort of spokesperson.
Yeah, of course, but you do have it-
But
an
I
idea
have
of
the
it.
knowledge because I've worked in government hospitals where there are facilities, and I actually started one of the thalassemia centers in Pakistan Institute of Medical Sciences, which is
Right.
actually going on. The thing is that blood is available in most government hospitals, and a lot of government hospitals in big cities at least have facilities to get the thalassemia patients, give them transfusions.
Okay.
But the important thing is that once these patients get blood has got a lot of iron in it.
Okay.
And that iron gets deposited in the body.
Right.
And in very important organs like heart, for example, or other glands, liver, bones, etc., and
Okay.
can cause most of the complications and the fatalities in cases of thalassemia are because of iron overload in the heart.
Okay.
They actually have heart failures and things.
no.
So to get rid of this iron which is in the body, we need various iron chelators or iron removing drugs.
Okay,
Those are expensive, and the facilities for those drugs are not adequate in most government hospitals.
Right.
But recently, the government has taken up an initiative both on the preventive side and also on the treatment side.
Okay.
And Pakistan Baitul Mal is playing a very important role in
Wow.
this, and they are giving these iron chelators to the patients, and they
Which
are
are generally like super expensive to afford
they
for
are
one's
very
own self on a
expensive
regular basis.
in cases of these patients. I think the families are desperate, and
Yeah,
they
yeah.
really have to be sort of quite rich to afford the treatment, because it goes on for life. It's not a one-day treatment or a one-week treatment.
That's absolutely true. Thank you so much for saying that. But since we're short on time towards the very end, Dr. Sawa, want you to sort of convince and tell everyone out there how important it is for them to have a regular blood picture checkup, right? I mean, everyone needs to know their condition, right? Please go ahead. And also to everyone out there living with thalassemia every day, your message of encouragement to them. Here's your camera, please go ahead.
Well, the importance of blood testing, I think, of course, it's important on a regular basis. It should be tested. Well, more than that, I think since we're talking regarding thalassemia, I would like to particularly give a message to the affected families that we can diagnose this disease in pregnancy as well. So that's a very other important aspect of prevention of thalassemia. The people who already have children with thalassemia major, they generally come to us, and we introduced this test in 1994, and myself and Dr. Yasmin Rashid, we were colleagues, and we started doing this, and she was able to take the sample from the...
He was actually the first person who did the introduced prenatal diagnosis.
And once we take the sample from the mother, we can actually do the DNA testing on that, and we can give a result which is nearly 99.9% accurate. And the parents have the choice to
either carry on with the pregnancy
or get whatever. So it's ultimately the parents' choice. So I think through your channel, I would particularly like to give a message to the families that this is a very, very important aspect of prevention. The one that I talked about is carrier screening, which is before marriage. If people they get convinced, they should get tested before marriage. But once they are married, then the solution is also there. They can get tested during pregnancy. And this test has to be done in every pregnancy. This test is widely available in Pakistan. I think there are facilities available in Rawalpindi, in Lahore as well, and then in Karachi. But we need to also disseminate these sort of services as well.
Definitely.
This is a very important point which Suhaib has actually talked about, because a number of people who are actually married, they thought that it's the end of the world, but it's not the end of the world. If they get tested, then they make a decision.
Better decisions,
but in cases who are not actually married, but they have patients with thalassemia in their family, like for example, I give you the example of Saira. Once it was known that she had thalassemia, she was counseled, and the family was told that get her siblings and other members of your family tested. And in her family, her elder brother and sister were actually carrier. So at the time of marriage, they actually got the other cousins tested to see whether they were carriers or not. So they got married to normal, and then it means that they're
less chances of...
No chance of having a thalassemia major. They can be carrier, but not patients of thalassemia major.
Thank you so much for that kind of information, and thank you so much for joining us, especially early in the morning, especially when we're fasting as well. Saira, thank you for being here. Dr. Suhaib, Ahmed, Dr. Tahira, thank you so much. Ladies and gentlemen, today was World Thalassemia Day. We definitely tried to inform you as much as we could on, well, just a limited time that we have. I really hope you learned something from us. If you did, you have to write to us on our Facebook page. And before that, since it is the month of Ramadan, a lot of you are getting together, you know, to pray and even recite Quran and share everything good that you have. Please remember me and my team in your prayers every single day. Write to us on our Facebook page with the name of World This Morning. On Twitter, World This Morning without a G. Daily Motion and YouTube, also World This Morning. And the repeat you can catch at 11 p.m. tonight. Till the next time, take care. Good morning.